There are 4 different kinds of surgery that we offer, and which kind of surgery we offer will depend on the particular patient. There are 2 kinds of surgeries that we offer called symptomatic surgery. So these surgeries aren't aiming to change the way that your body deals with the extra lymphatic fluid. It's aiming to change the appearance of your body, and basically with that change in appearance and maintaining it with lymphatic therapy, able to move and do things that work better for you. One of the surgeries that we do is called lymphedema mass excision. We see this most commonly in patients who are either overweight or sometimes in patients who've had weight loss surgery but still have a lot of extra tissue. The most common place that we see this extra tissue is hanging from the inside of the thigh. These masses that are hanging from the inner thigh can weigh 10, 20, 30, 40 pounds, making it almost impossible to walk. I've taken care of patients who were wheelchair bound because they had this mass of extra tissue hanging there. One of the things that we can do is remove that tissue in a 2 or 3 hour surgery and literally allow somebody to walk again. Another symptomatic surgery that we do is something called lymphedema liposuction. Lymphedema liposuction sounds very similar to what it is. It is liposuction of the affected area, whether that is the leg, the thigh, the arm, or another part of the body. The most important thing to understand about lymphedema liposuction is any extra fluid that was there before has to be removed before surgery by lymphedema therapy, which includes wrapping and massage. After the extra fluid has been removed by lymphedema therapy, we can do aggressive liposuction to reduce the fat and scar as much as possible in the affected limb. And then you return to lymphedema therapy afterwards. The gains that you were able to get, as long as you were consistent with the lymphedema therapy, can be lifelong. We also offer physiologic surgery. Physiologic surgery, in fact, aims to change the way that your body deals with lymphatic fluid to actually change the process of the lymphedema itself. There are 2 different kinds of physiologic surgery that we offer. One is called LVA, or lymphaticovenous anastomosis, and the other is called lymph node transfer. Lymphaticovenous anastomosis is almost like a plumbing operation. Essentially, we have the vein and the lymphatic running in parallel. Let's use the example of an arm. So let's say that you have relatively early lymphedema in your arm, but have swelling in your lower arm and hand, but are not affected in your upper arm. That means the lymphatics up here are working, but the lymphatics down here are blocked. What we can do is essentially make a bypass or an anastomosis, which is another name for a connection between the lymphatic and the vein, providing an alternate pathway for the lymphatics to go up your arm. This surgery is as minimally as invasive as it's possible to get. It's essentially like a deep paper cut, and going in beyond the deep paper cut, I find the microscopic lymphatic and microscopic vein, both of which are less than 1 millimeter big, and sew them together. There's also lymph node biopsy. Lymph node biopsy involves transfer of lymph nodes from one part of your body and moving it to an affected area. So for example, if you have a history of breast cancer and you had lymph nodes removed in your armpit area and are now affected with lymphedema in your breast or your arm, we can take lymph nodes from your lower abdomen and transfer that into your armpit area. One of the questions that we get a lot is, how do you know you're not going to cause lymphedema in the area that you're taking the lymph nodes from? Well, there are 2 reasons. So number 1 is anatomic, and the second one is we test for it. So in terms of anatomy, the place that we take the lymph nodes from is in the lower abdomen, not in the groin. So it's not from the inside of the thigh, it's really from the bottom of the abdomen. That's number 1. And number 2, we also use a technique called reverse lymphatic mapping, where we actually test for the lymph nodes that are draining the leg, and we make sure not to take them. Something that is a really important part of how we treat patients here at RPS is the issue of choice. So we always want the decision about surgery and what type of surgery to be a discussion with the patient. So there are very few surgeons in the whole country, in the whole world, who do lymphedema surgery at all. Even more so, a number of those surgeons only offer one technique or two techniques. What we offer here at Ro Plastic Surgery is 4 techniques, really making sure that we align the procedure correctly with the patient, which involves not only a really thorough understanding of the patient and what they've been through, not only a really thorough expertise in all of these surgeries, but also understanding the patient's goals and being able to do what we can together to help them achieve that.